Welcome to On Call with Dr. Jason Golbin. I am super excited. We have an amazing guest here today. Sitting next to me is Dr. Pratibha Vemulapalli. Did I say that okay?
Kind of good.
Give it to me better.
Pratibha Vemulapalli.
Oh my God. Well, everybody
Well,
calls
please,
her
I was gonna say.
Pratt for short.
Absolutely.
So the whole world in our organization already knows you as Pratt. And you have jumped in headfirst and have been an amazing, amazing leader. You are our current and new chair of surgery at Good Samaritan University Hospital. And I think you've been an amazing addition. But let's start at the beginning, right? Sure. So you're a bariatrician, so you're a bariatric surgery. Where did your medical journey start? Tell us how you got to where you are today.
So, it's so funny when you talk about medicine, right? Because medicine's everywhere and stories of medicine were everywhere. So when I was a kid growing up, one of the things that was really big was, and this is like dating myself, but there was a guy named Barney Clark, and he got this artificial heart, the Jarvik 7, which was the latest and greatest.
Yeah.
There was a kid in Pittsburgh named Baby Faye, and they put a baboon heart in her. And
I remember these things. Wow.
back then,
Yeah.
it wasn't like it didn't work for that long. But it was the beginning, I think, of a revolution that, recently NYU, they did the whole pig heart. So I think it's it's pretty amazing. But that's what, it was on the news, right? When you watch TV with your family, you were watching the news essentially back in those days. And it really I thought it was amazing and remarkable. It was kind of like, like the moon landing moment for medicine, I thought, at least as a kid. And that, I think, is what started kind of my interest in medicine. And I always thought that's something like that is what I wanted to do. And then, catapulting to, like everyone else, college.
Where'd you go undergrad?
So I went to Penn State.
Oh, really? Are you from Pennsylvania?
I'm actually from New Jersey, but I did I did most of my schooling in Pennsylvania.
Okay.
I don't know what that means.
I wonder why. Right. Do you like cheesesteaks or do you like Italian food from Jersey?
Oh my God, Italian food from Pennsylvania.
Oh, really?
From Philadelphia, because I was in Philadelphia for a while.
Ah, okay.
And I have to say, some of the best Italian food.
That's
ever.
funny. That's it. That's interesting. So you went to Penn State. Where'd you go to med school?
So I went to Jefferson in Philadelphia.
Oh, okay. So truly, Jefferson's an awesome school, and they've done amazing. And then where'd you train, and why'd you pick bariatric surgery?
So I did my residency at Robert Wood Johnson, right, which is the big hospital in Jersey, and I did a fellowship in minimally invasive surgery up at Montefiore up in the Bronx. Back then, minimally invasive surgery was brand new. Like now, robots are new and the big thing. But back then, we were it was a brand new time, right? You're going beyond the gallbladder.
Right.
Let's put it that way for minimally invasive surgery. And so I went up there and I stayed on, and bariatrics was a little bit of a happenstance for me. We were doing everything, and it was a lot of fun, and it was great. And as we started to do more and more things, bariatrics became big because, again, just to go back a little bit, I remember when I was a resident, we did a few bariatric surgeries, and it was open, and it was these big incisions, and
Well, those the Roux-en-Y?
that was the Roux-en-Y.
Yeah, God, I remember that from
The gastric
residency, too.
bypass, right?
I was on the other side,
On the
receiving
other
those
side,
patients in the
receiving
ICU,
those
right?
patients,
Yeah.
they'd be in the ICU,
Yeah,
they'd have a lot of pain.
Big deal, yeah.
The incision became the biggest barrier, really, to get to many of those patients getting better. And then all of a sudden, people started doing it minimally invasive, and that's what helped really launch it. So we started doing, minimally invasive gastric bypasses, and we got better and better. And it's so funny, like when we started, it used to take us 3 hours. By the end, we were doing them in 45 minutes.
Wow.
People were, they were waking up the next day, the same day. They were walking around. They were laying in their beds after surgery, arms behind their heads, as if nothing had happened.
Wow.
So it really kind of catapulted everything that we did. And it was fantastic for the patients, people, it was their goal, right? To lose weight, to get healthy, really. And they were doing it. And we had, tons of patients, people who would come to the office and, 2 months after surgery and say, you know what, I walked here from my house, and
had
you
never
didn't quite
done that
understand
before,
it,
right?
right? As a physician. So, one, they could walk that far, but two, you realize they had a certain amount of hesitation and agoraphobia because they didn't want to be seen outside
Oh, that's
in the
interesting.
size that they were. And so it made them mobile because they could walk better, because they didn't have pain. It controlled their diabetes. People who were on 80 milligrams of insulin, 80 units of insulin 3 times a day, and their blood sugars were crazy and their hemoglobin A1Cs were crazy. All of a sudden, everything was coming down and they were getting better. It's
Rewarding.
it's incredibly rewarding, right? You'd see people in the first 3 months achieve goals that they never thought were possible.
Their whole life, right?
Their whole life.
And when you look at why we went into medicine, so much we want to make a difference for people. So here you found the niche to make that difference for people. So you became a bariatric expert.
So I became a bariatric expert. We did a lot of bariatric surgery. We were doing, it's very funny when you go, especially back to the beginning. I always think to, having kind of been there at the beginning. Nowadays, everybody has heard about bariatric
That's
surgery.
right.
Probably everybody knows somebody who's had bariatric surgery. But back in the old days,
Old days being the early 2000s?
the early 2000s, right? It was like, Cyndi Lauper had just done,
Cyndi Lauper had bariatric surgery?
no.
Oh, I was like, wait, I didn't remember that.
I was going to say, Cyndi Lauper had just started Girls Just Want to Have Fun,
Oh,
right? And then
okay, all right.
the old days.
That's funny.
But, back then it was new. And I remember the adolescent patients. The pediatricians would only send me patients that were very, very sick. So I remember I got to know the head of pediatrics because they sent me a patient that was on her way to renal failure.
Wow.
She basically was going to need dialysis. She couldn't get on the transplant list because over a
She was
certain
too heavy,
BMI,
right?
You're too heavy and you have bad outcomes.
She was a teen?
She was a teen.
Oh, my God.
And so they said, okay, why not give this a shot? So we operated on her. We did a gastric bypass laparoscopically. Did incredibly well. Didn't need dialysis for another 5 years. Her mother ends up giving her a kidney because at that point she could get a kidney.
Right.
So it really changed the trajectory of her life. It made the head of pediatrics a believer. So she invited me to talk to her pediatricians because she said, "Hey, if we can impact this one kid's life, maybe
How
we
many
can impact
others?
others."
Oh, I love that.
And I remember going into the room, and all the pediatricians kind of looking at me like, "What? You can't touch our kids." So that was the old days.
Right.
And fast forward 20 years later, pediatricians are now believers, and they're sending you 12-year-olds for medications, for surgery,
Right.
saying,
Impact early.
hey, how
Yeah.
can we impact early? How can we change the trajectory of this disease?
That is awesome. I can only imagine, so rewarding. The one that I remember was Al Roker. That one was all over the news, and everybody watched that kind of real time, and you say, "Oh my God, this really, really, really works." And I agree with you. The change to minimally invasive was the game changer.
Huge game changer.
Those patients I remember were sick, immediately post-op, and then had complications.
Yeah.
Still was life-changing for them. And I guess it's a risk benefit analysis each case. But that's awesome. Okay, so you become a bariatrician. How do you get out to Good Sam? You're now our chief of surgery. How do we get lucky enough to pull you out to Long Island?
So I have to say it was such a great opportunity, such an amazing team that I get to work with every day. Really the nicest people, so committed to patient care, so committed to the patient experience. Really treat everyone like they're a family member.
Oh, I love
and
that.
that's it's a university hospital doing big cases, doing extraordinary things with aneurysms and brain surgery, doing extraordinary things with heart surgery that you would see at a major academic medical center, but still with that touch of people know each other's stories and they say hello all the time. In fact, I was having a conversation with somebody the other day about how everyone at Good Sam says hello. Even the person mopping the floors will
We
say
want
hello
that.
to
We
you and
train that.
stuff.
We love that.
Absolutely
Oh,
fantastic.
you're giving me joy right now. I grew up at Good Samaritan. I was a medical student there in 1999, doing cardiology with the old. I learned how to read EKGs in that building, and then that was my first job coming out of training. And I agree that there's something special. I had my baby in that building, and I'm happy to hear that that's part of what attracted you to the building.
Absolutely.
Now, Good Sam is going through its own amazing changes, sort of like we saw the transition with bariatrics. So we're seeing the change in the building of Good Samaritan University Hospital. We're getting our brand new patient care pavilion opening this year, really, which is just a wow. Tell me about the new building. What does it mean for surgery, right? Because now you're looking at it not just as a bariatrician. You are the chair of surgery. There are oodles, I don't know the number, oodles of surgeries that are being done there every single day and night, right? That
Yeah.
place is busy.
We're doing
and
60 surgeries a day.
Yeah,
It's
wow.
a huge volume
And
on just Monday through Friday.
right, and then
forget about the weekends.
forget
and
the trauma
emergency
one,
room and the
like you
trauma.
said, advanced cardiac surgery. We just had an amazing presentation from Tim Carter talking about his aortic center. I mean, just a wow. One of my previous guests was Kimon Beckless, who everybody on Long Island knows, right? He is our system chair for neuroscience and doing, again, the most cutting edge stuff along with that community touch. So what does the new building mean for surgery, for you as chair of surgery, and how are you approaching that?
So I think the new building is going to be amazing. Amazing for Good Sam, amazing for Long Island, amazing for Suffolk County, because what it's going to do for surgery specifically is it's going to allow us to house everything surgical in one building. And obviously there's other parts of the hospital that we need. But if you're a trauma patient, you come in to the bottom floor, huge, space is no longer going to be a constraint,
It's amazing.
right?
Yeah,
The rooms are huge for everything.
for everything.
But you get your treatment, you get a CAT scan right next door, so you're not walking far to get all the things that you need. Everybody that you need can come into that room because it's an enormous size. You're not bumping into anything. But if you decide, or if if the trauma surgeon decides, or the medical condition decides that they need something done, whether it's, let's say you need to go to the operating room. The operating room's, a floor above you. So
awesome.
elevator, you're right there. For the patient, that's great. But for the family, that's great too, because you know where to go and you don't have to trudge through a big medical complex. It's the distance, but it's also the anxiety and the unnerving feeling of where am I going to see my loved one? And you don't need that when someone's sick. You want to know, hey, I park my car and I'm here, right? And you'll be there in the trauma bay. You'll be there if the patient needs to go to the operating room. It's the same spot, a floor up. You'll be there if they have to stay, whether it's in the ICU or whether it's on a patient floor. The amazing thing about Good Sam is, or the new patient care pavilion is going to be that the patient floors are just as nice. We know that patients, their families want to stay, and we encourage that. In these new single unit rooms, it's literally like being in a, and I might be a little, exaggerating when I say this a little bit, but it's like being in a Vegas hotel room. It's a large window. Right, just like you
won't look on the strip, right?
Just not on the strip, it's a private room. Your family member can stay. You've got a private bathroom. You've got the latest in technology. If you want to, look, staying in a hospital is never fun.
Never.
But we're trying to make it fun in that you can recover and you can focus on recovery.
I love that is near and dear to me. As you know, we are working so hard on the experience of our patients throughout our organization, and I to hear the chair of surgery talk about the impact on the family, and how it's not just built around surgery, right? It's built around the comfort of what everybody needs to, like you said, focused on rest and recovery and get better. That's awesome. I don't know if I think about Vegas though that's awesome. I like Vegas.
It's what it is.
It's the big
just
window,
it's
so
the
it gives
big
you that. I
window.
love
It's
that. I love
great.
that. That's awesome. As our CEO says, patients have a choice, and we want Catholic Health and specifically Good Samaritan University Hospital to be that choice for our patients on Long Island.
100%.
We think we can get patients from all over Long Island, to be a destination in West Islip.
Yeah,
I love it.
I absolutely think so.
I'm so happy to hear you talk about that. All right, so let's go back to bariatric surgery. So awesome field, like you said, you were at the cutting edge, you were at the start of it, but things are evolving again. As the only thing constant in life is change, right? And out come these amazing drugs, and that are having that similar kind of renaissance of changing people's lives now without surgery. Talk to me a little about the GLPs, the impact on bariatric surgery, the impact on the patient population, and what does that mean as a bariatrician? Because I know you are not just looking at from the surgical point of view, you are looking at from the whole weight loss continuum.
So I think GLP-1s are great. I think they help people, start on that weight loss journey. If you have a BMI of 30, if you're 30 pounds overweight, I think it's a phenomenal drug. If you're diabetic, it's a phenomenal drug, right? Every diabetic, they lose 5% of their body weight. They have a chance of not becoming or not being a diabetic. The GLP-1s, the unsuccessful patient will lose 5% of their weight, of their body weight. So
unsuccessful,
it's
wow.
the unsuccessful patient, right? The patient who isn't
Right.
really capitalizing on the GLP-1s. So I think they're absolutely fantastic. I think it's where every patient really should start, their journey towards weight loss with, of course, things like good eating and incorporating, nutrition, incorporating exercise into their life. So I think I think they're absolutely fantastic. Where they, I think, interact with bariatric surgery, GLP-1s, at some point you have to come off. And they may not always be right for you. There are patients who can't take GLP-1s for a whole host of reasons. There are people who don't achieve enough weight loss with GLP-1s. And then there are also people who've had surgery or need a GLP-1 on top of a surgery to really get them where they're going. I think it's still an evolving field. Where do the GLP-1s 100% fit? I think we're figuring that out as we go. How long do people stay on them? I think we're figuring it out. Where does surgery and GLP-1s 100% interact? We're figuring that out. And I think that's the exciting piece of it. We're figuring it out.
As you know, we also have a Center for Integrative Medicine, led by Dr. Robert Graham, really world-renowned, a chef on top of being a doctor, pretty cool. You see the patient, how do you prescribe the package for them?
So I think everybody recognizes that to be successful, right, we've got to have the whole package. It's not about the drug alone. It's not about the surgery alone. It's people are successful when we integrate the drugs, the surgery, and lifestyle changes, right? And integrative medicine is all about lifestyle changes. How do you...
Which is probably the hardest of the three.
It's the hardest of the three, right? How do you undo habits like stress eating, eating late at night, right? Things that we all have. How do you undo those habits of being sedentary, which our lifestyle is predisposed to? How do you get out there and exercise and make it a part of your life? And that conversation is very different if you're having that with a 20-year-old or a 40-year-old versus a 70-year-old. And, you talked about why GLP-1s are great, because we have great treatments now for 70-year-olds and 80-year-olds to help them live longer.
Right, it's right. It's health span, not necessarily lifespan.
100%. And that's what they do. And I think, it's interesting, integrative medicine, it's different and it changes for every generation. Generation X has the recommendations and the way they integrate with it. And I think the 70-year-olds have other ways that they need to integrate with it. It's very different when you talk to someone who has never gone to a gym and may have gym phobia, and how do you get them out and how do you get them exercising and how do you do that in a safe way when they may have other mobility issues? So how do we take it from fresh fruits and vegetables and integrate that with cooking healthy, eating healthy, whether you're eating at home or whether you're eating on the go?
What makes you excited outside of the hospital, right? What does that spare time look like?
So I actually love gardening.
Really?
I do. I can't say I'm a great gardener, but I keep trying. So I
don't think I would have guessed that.
I was going to say, I absolutely love gardening. I would love to, I actually would do more. Like if I had the space and the time, I would love in the summer to grow my own garden and have like
eat
a
that
couple months
food,
where you can
yeah.
eat that food yourself. Like
Yeah.
there's something really nice about growing the plant, um, and then getting, the and I truly think the fruits and vegetables taste better when they're
Fresh,
smaller,
homegrown, yeah.
homegrown, right? Picked at the right time. So I'm a huge fan of that.
Yeah, that's awesome. We have, not necessarily gardening, but we have a beekeeper that works with us in credentialing.
Nice.
Yeah, and she just brought in
Fresh
the
honey.
delivery of honey. Oh my
Wow.
God, it's something about that fresh. What do you think it is that drives that passion?
I think it's incredibly relaxing. It kind of gives you this small amount of time where you're doing something completely outside of your norm, I have to say, and then it gives you, the ability to internet search things that you wouldn't normally internet search. I have to say I have a toothbrush, an automatic toothbrush that I use to fertilize my tomato plants. So, we're all control
Really?
freaks at heart,
Yeah,
right?
that's so interesting. It's been amazing getting to know you. So now I want you to put yourself in the shoes of a young, aspiring doctor, maybe somebody just, making their way through med school, trying all their specialties, trying to figure out what they really want to do to have this sort of impact.
Honestly, the one thing that I wish I knew in their shoes was that it's all exciting and that it's all good. There is no one specialty or one disease state. I could see myself doing 20 other different things in medicine and be just as interested. One of the greatest things about being a surgeon is sitting in the OR lounge and talking to the other surgeons about what they're doing. What I do is absolutely fantastic, but what they all do is absolutely fantastic. And then outside of the OR, right, you have such amazing doctors that you collaborate with, infectious disease specialists who are so good in their field, and, intensivists that are so good in their field. There is, in medicine, I truly believe you can't go wrong. I think it's so impactful. I think it's so interesting. And you're going to find that piece of every single specialty that is so interesting. And I think in every field of medicine, there's so much technology infused that I think everything is changing. And I think it's a great time. I think it's always a great time to go into medicine.
Well, Prat, we are so honored to have you as our chair of surgery at Good Samaritan University Hospital, as our renowned bariatrician, and I think the future is so bright for Good Sam under your leadership.
I think it's going to be fantastic.
So thank you for joining me, and it's been an absolute honor.
Thank you.